Very
Thank
nice to
you.
meet you. Um, I'm with United Healthcare. As you already know, I am one of the managers for the North and Central, but we cover all counties, and I'm in the marketing department. So we work with Medicaid. We have Medicaid and Medicare. So they're like two separate teams, but we always work together. And one of the things that I'm doing now is I'm reaching out to a lot of the schools because as I was telling Marlon, I reached out to him and I said, we have really good news. We have now all children, all undocumented children qualify for Medicaid starting January 1st, 2023. Regardless of their immigration status, they can apply for Medicaid. It is still based on their income, but this is something that we weren't able to do before. Um, and we have had a lot of schools to reach out to us. And what I'm doing is we're putting together an event, a program, and we're coming out to the schools to give the opportunity to all of the parents who want to fill out the application to do it with us. Because when it comes to insurance, people get confused. They think it's complex. They don't know where to go. Sometimes some people say go online and do the application online. Other people advise to go to the Board of Social Services. When you're there the whole day. You can't even get in. If you call on the phone, you never get through. People don't know who qualifies, who doesn't, what documents you need. So I'm here to answer all of those questions with the parents. So in the workshop that we had previously, that's what I did with them. And what we're planning to do is on February 18th, it's a Saturday. It's the 18th, right? I'm going to be there with my team. We're going to be there from 10 to 2. And any parent that wants to come is welcome to come, and we'll come with the computers ready to do the applications for any families that have children who are undocumented. The things that I need with me are I need an address, because after I fill out the application, they will get a packet in the mail. And that packet is going to come from NJ Family Care, asking them for documents in order for them to really find out what their income is, because this is based on income. So when I do the application, I will ask them, what is your income? Where do you work? I put the address of where they work. I need to know if they get paid on a weekly basis or if they get paid on a bi-weekly basis. And then they have to give me an amount, right? So let's say the parent says to me, I get paid every 2 weeks and I make $700. I put that in the application. When the application gets processed and goes to NJ Family Care, somebody will open it, will look at it, and now they're going to send a packet to the family saying, well, can you prove that you make $700 every 2 weeks? We need a pay stub. So that's when the person has to provide the pay stub. So I always ask, I need to really know, this needs to make sense and it needs to be the truth, and we need to be able to verify. Now, we came across a lot of families that they work and they get paid cash. And that's okay. We ask for a letter from the employer, just verifying that this person works there, that they started working on such day, and the letter has to have the date when they did the letter. It can't be past 30 days. And then in that letter, they have to write the amount of how much they pay the employer. And then signed by the manager, or if it's an agency, that's okay. A lot of people work in a temp agency. We will put that address as their work. Some people work with and they get paid with a card. There are ways to go online and register the card to find out how much they get every 2 weeks. We ask for the date of birth for the child. We need the information for the parents, and we just put the application through. And
I just have a quick question that you were mentioning all that about. So let's say on the 18th, right? We're gonna have the event, and the parents are gonna come and they're gonna fill out the application, and then it takes about another 30 days for them to get the package. Now, so at what point between now and then do they ask for that letter from the employer? Because let's say if they had it right now
in the packet. Oh yeah, but there's nothing we can submit because we don't know what they're gonna ask. Everybody's different.
Yeah, no, but I'm saying, so should they, if they know they're gonna need a letter from their employer, should they ask for it now or wait until they receive the package asking them for that letter?
I would wait in case it takes longer than 30 days because the letter needs to be recent. So it can't be if if we're in February, I don't want a letter from January and we're entering March.
Okay, so if the case was that they will need a letter from the employer, then the recommendation is to wait until they're asked for it by New Jersey Family Care, correct?
Yeah, to wait, but to start talking to the employer and let them know, listen, I want to enroll into this program, Medicaid for my child, is based on income, and I need to verify my income. And since you pay me cash, would you be able to kindly write me a letter that says that I work for you, and that in the letter it states how much you pay me on a weekly basis. And you explain to them why the letter is to get it ready. And then as soon as you get the packet, then have the letter, as current as possible.
Okay, perfect.
So that would be that. And so we're planning on coming out to assist the families. And I also informed everyone that now if somebody's under asylum or they're refugees, they also qualify for Medicaid. And we just need, if somebody has asylum, they're given a document with a number on the upper right-hand corner of the page. We need that number in order to process the application, in order to fill out the application. They ask us for that number because if somebody has asylum, they qualify as well. So we're planning that, but we're here not only to help on that day. I provided, and I'm gonna just share it because I still have it. Do I have it open? No, I don't have it open. Let me see. I provided Marlon with my information, because anybody that wants to call me at any time, we can do the applications on the phone as well. So if you know of any families that are not able to come on that day, but they have, you believe that they qualify and you want me to talk to them to ask more questions to really understand the situation and be able to assess them and help them, I can do that. And if I feel, okay, this person does qualify for Medicaid, then we can do it over the phone. So this is not something that I'm doing just on that day that we go, but we're able to help all throughout the year. People can apply for Medicaid at any time throughout the year. And we have about 10 people in our team that are constantly just filling out applications. So this is the flyer that I shared with my phone number. If anybody has questions, if they want to know more, they can call me at any time. Anytime, no, not too late. And that's basically it. I'm actually super excited because I know that a lot of families are going to benefit from this expansion. And then Marlon is gonna help me to set up to like send an email to see if maybe we have an idea of how many families can come on this day. But again, if if you want to just take a copy, I gave you this flyer, right, Marlon, or no?
Yes.
Okay, so maybe you can share this flyer with whoever you want to share. If there are other schools where you want me to do this too, like at another time, another location, and we put together an event, we can certainly do that.
Okay.
I have a question.
Sure.
When you say it's based on income, it's based on the standard income that's on the New Jersey Family Care,
Yes.
whatever their chart is. Okay, and that's for undocumented children.
Yeah. Well, that would be for anyone who wants to apply for Medicaid. We will look on for the eligibility requirements. We will look on the chart, and we will see if it was for an adult, they cannot go over that number per person.
Number.
But
What about
depending on
well, I'm just talking specifically the undocumented children.
So we will count everyone in the family, and we will look at that number.
And it's based on their income.
Yeah.
It's still based on, okay. All right, that's good to know. Thank you.
And there's so many different situations. So we look at one by one. Sometimes you have like a mom and a dad. They may have two kids, but they may have like a cousin that is living with them, or they may have a child that is the dad's, but the mom lives somewhere else. So every case is different. And we're able to
Yes.
write it on the notes when we're doing the application. We write on the notes and we really explain what the situation might be. Some people they have a child, but they're separated. And so now in the family, the husband, the dad is not there anymore. So we don't count the dad because it's only two in the household. So now that's less people. So we kind of take case by case. And then what my team does is we follow through, because doing the application is the first step. We do the application. They wait a few weeks to get a packet in the mail. When they get the packet, it's time sensitive. They have to open it and they have to see what documents they're being asked. If they don't send the documents, that's the reason why most of the people are ineligible, because they don't send the documents, so they can't prove. So we follow through and they can call us. When we fill out the application, they have our phone number, whoever's doing the application, and we tell them as soon as you get a packet in the mail, if you're confused, if you want me to help you when you read the letter, I explain to you, I will do it. Call me, show me the letter. I'll tell you what documents you need to send, what letters you need to write, then send it in the mail. And then that person can call us back in a few weeks to ask us, well, I haven't heard anything, I haven't received anything. And we're able to go on the platform that we have and we can see, well, the process in the application, the person received Medicaid, they're going to be effective on such and such day. So we let them know, just be patient, you'll get the card. If they didn't get it, we can see what happened. Did you send the documents? Maybe you didn't send them. And if it gets denied, if it's less than the 3 months, we're able to kind of like go back and find out, well, did they miss anything? Let us resend the documents. If it goes over the 3 months, the best bet is just to reapply. But we want to be able to do that follow-up because we understand that sometimes people forget, they don't open the mail, they don't follow through, they don't send the documents. And some people need a little more guidance.
Thank you.
I have two questions. One is, so you were mentioning that you do write notes and everything. So when they receive it at the other end, the New Jersey Family Care representative, they're able to see all the notes and stuff, that the explanation that you're giving them. And now if
Yeah.
the parent was doing this on their own, there's no notes or anything, right? Because I mean, they're not able to. So that's like a big advantage that you have.
Right.
Also, once they receive the package, do you know if it needs to be sent via mail, or can the documents be maybe like email or fax? I'm asking because once, let's say my family's right here at the preschool, if they receive it, more likely they're gonna tell me, hey, I received it and I have the documents. What would you recommend? Just like sending it in the mail in the envelope?
So the best
Or
way to do it, the packet comes with an envelope inside, so that they can take the documents and mail it back with that address. If there's an option, you can either do that, or you can log in on NJ Family Care and create an account and then put them through there. But to me, I find that sometimes not everybody's very computer savvy, and they don't want to do all of those steps. So because the envelope is right inside the envelope that they get, it's easier for them to just make a copy, never the originals, always make a copy and send it out, because it already has the address where to go. So it's a lot easier.
okay, thank you.
I have one more
And you want
question.
it, and on the letter, it tells you how many days they give you to send those documents. And they don't give you too long. It's no more than 15 days from the minute that they get the letter in the packet in the mail. It tells you you have until this day to send us all the documents to process. So many times what I do is, if somebody calls me and they tell me, oh my God, I just got the letter, I didn't open it, and they were due yesterday, I tell them, let's call NJ Family Care right away. And I get on the phone with them to let them know this is what happened. Can you please extend it and give us a few days? And at that moment, most of the times they say, well, can you fax it to this number? Because they want to get it right away. So we're able to, follow up if they're a little bit late, but they rather get it in via mail. Sometimes some of the applications go to the county. If the applications go to the county, they may take a little longer. So if it's a child that is disabled, that application will go to the county. It's not gonna come straight to the state. And each county takes a little more time than others, and they handle things a little different. So if it's called ABD application, which is aged blind, or disabled, and those applications go straight to the county. And then if we want to follow up, we don't call NJ Family Care. We have to call the county. But I don't like calling the county because it takes so long. So that's why those applications, I really like to be extremely careful, detailed, so that everything is very nice and precise and things just go through very smooth, and people send the documents, and then lastly, after they send the documents, they'll get the ID in the mail.
Can you tell us more about this unwinding process and what's required?
Oh, for now that everybody's gonna have to renew?
Yes, yes.
Yeah, so everybody is going to start getting a letter to really to renew. And that for us actually is going to be a little bit complex, because remember, I'm only United Healthcare, so for the unwinding, it's gonna be more auto assigned. So, and the families, what we're doing is, this is something a little different, Marlon. Now, you know, Medicaid, you have to renew every year. When COVID came, we stopped that. So people just continued Medicaid due to COVID. But now every year they have to renew. You have to provide documents again, and you have to prove that you have the same income in order to stay.
But I believe when they get the application, it comes pre-filled already with the information they have previously provided. So they need to fill in and check everything that's the same. Anything that's different, then they will need to write down, what is different. And then, like Paula said, they will still need the proof of current proof of income.
Yes, definitely, they do. And so my department is really getting ready to help. Our team is gonna separate a little bit to be able to help everyone that is going to start getting those letters, to assist them and to help them through the process as well. Give me one second.
What's the best way? Let's say, I have New Jersey Family Care, and I renew it every year, but I moved. So what's the fastest way that I can change my address in the system, so when they send the renewal, they send it to my new address?
The best way is to go in the back here and call the 1-800.
Oh, okay.
That would be my best way. Now, it depends on who you have. We used to have a department for member services, where we would go on the app. It's like a platform when we would put the new address, so the person will get the new cards. But now the best bet is just to call 1-800, the NJ Family Care. Some people also, if they have so now with all of the changes that are coming, sometimes you have a lot of families that say, well, my son is United and I went to the hospital, and now my other son is Horizon, and these things happen. They don't know who signed them up, who changed them, who gave them. So any changes, they can't come from us. They have to go straight to NJ Family Care. So they have to call the 1-800 number and ask those questions, because usually they want families to stay together. So if a lot of families have Horizon and I'm not aware of that, and I'm gonna sign up somebody with United, they may make the change, and that's happened a lot to us. So I always ask the families, you have 3 kids, both of them are Horizon. Are you happy with them? I just want to let you know I'm United, because you might want to stay everybody together. When people come to me and they tell me, and majority of the times they want to switch because the specialist doesn't take Horizon or Aetna. And at that point, they say, the provider will say to them, listen, I only take United. So if you want to come here, you might want to switch to United. So they can come to us for that. And then we send them to the 1-800, because we can't make any switches. We don't switch anybody. So if somebody already has it, I can guide them, but we cannot make any of those switches.
I know that you said that, going back to my previous question about calling to change the address. Now on the card you send me, that's the one that says, let's say in this case you say I will have United Healthcare. I will call the United Healthcare rep, is that the same as calling the New Jersey Family Care 800 number? Is it, are there two?
No.
Is it, I
You
only
will call
notify
member, yeah.
one person?
You will call member services. Member services is the number here and
Okay.
in the back of the card.
Okay. Just wanted to make sure. Now, some families, they get that card, right, that has the logo for, let's say, United Healthcare, but they also get a white card with a blue stripe in the middle. What is that?
So you may have straight Medicaid and people always had the Medicaid card, but then you have to assign, you have to look for an MCO. Right? So you may have just straight Medicaid before people only had straight Medicaid,
Yeah,
but now
so-
you have to, if you don't pick on the application, if you don't pick somebody, they're gonna pick for you.
What's an
It's
MCO?
us. We're like a health insurance company.
Oh,
It's us. So if you don't do it, they're gonna auto assign and they take turns. And now with the unwinding, because remember, a lot of people with COVID, they didn't have jobs or maybe they lost their jobs. A lot of people are not going to qualify for Medicaid anymore because now they found a job and they're making too much money. But we want to advise them, okay, maybe now you don't qualify for Medicaid. If your income change, now you go through NJ Cover and maybe you can apply there and you find something through Obama. But United Healthcare is not part of that. So if they go through NJ Cover, we're not part of the program.
oh. Another question. When they apply, when they do the application for New Jersey Family Care, is that when they decide what if they want Horizon or United Healthcare? Like at one point during the process, do they get to choose?
Right at the end, towards the end of the application, when I'm done with everything, at the bottom, it tells me what insurance do you want this person to apply for, and it gives me the options, and all
So
of them are there.
it's on the original application. Let's say when they come that Saturday, by the time they're finished, they will have more likely selected.
Yeah,
the right one.
before the application is over, I selected myself. I selected.
Okay, perfect.
But many times when it goes to the state, as I mentioned before, sometimes if they have children that have other insurance, the state will switch them. So that's why I always like to ask. If you have 5 kids and 4 of them have Horizon, I always tell them, are you happy with Horizon? I just want to let you know because we're united. This is what we offer. These are the benefits that we offer. These are our extended benefits. How do you feel? The kids have specialists, so that everybody's on the same.
Okay, so let's say I have, two younger children that were born here, and then my older child, I don't have insurance because they were born back in Nicaragua, and I'm applying for that one child. Let's say I have Horizon, but like you said, I'm not happy with them, and now that I'm filling out the application for my son, I want to have United Healthcare. What will the process be to get my other 2 children in the same?
So then I will do the application for that one. I will make sure I put United, and I will let that person know you need to call the 1-800 number and make the switch, and it's automatic. They don't have to speak to anybody. You make the switch, you call, there's like option 2 and then option 3 if you want to switch, and they tell you, do you want United Healthcare number 1, that number 2, and then they can make that switch. But then I would like to follow up later on, give it a few weeks to really look in the platform and see, okay, now the whole family is in United. We're good. Everybody's good. Because it takes a little time, but we're able to help. But remember, any switches I can do, nobody's able to do switch. Nobody can switch. They have to do the switch themselves.
It's funny because during our Spanish meeting, this didn't come. I don't remember this coming up in the conversation because we were busy answering all the questions. But it's good that you're bringing it up now in case somebody reaches out and wants to know.
No, I'm excited. I'm excited about our event. And if you feel, depending on how it goes, if you feel, Paula, let's go to another school or let's do it somewhere else. This is what we want to focus on this year because we know a lot of kids are going to benefit from this.
Perfect.
Okay.
My question is for Donna. I know that you're there, but will it be possible? Like, would you like to share your email so I can send you the flyers with the
Sure.
event information? If you can put it on the
Sure.
chat, and then that way, I have the Spanish one. I had to finish up the English one today, and I can send it to you. More likely by tomorrow morning.
That's fine.
Perfect. Rosemary,
And
any
Dana,
questions?
take my my information down if we're here, if you come across any families,
Yes, I
any
have
help
it.
that you want. Also, besides helping with Medicaid, I'm a health educator. I'm bilingual. So United Healthcare has put together about 15 workshops that we do out in the community. So
Okay.
we also conduct baby showers. We have meetings with our members. We attend events, health fairs. So if there's a group that maybe, I don't know, a group in the benefit from some health education workshops, we conduct those workshops as well. United Healthcare through Medicaid, we have a program for our pregnant moms that is called Healthy First Steps. And so when a mom signs up with us, this program helps the mom from the minute that they are with us and follows her and assists her and supports her all throughout her pregnancy. She will have a nurse with her all the time. Just call her to check up on her, remind her of her appointments, talk to her about how she's feeling, if she's happy, if she's depressed, if she's sad, if she needs to talk to anybody, if she took her medication, if she took her folic acid, anything, just she will have that support all throughout the pregnancy. And then the nurse will also provide her with a lot of resources, outside resources that she might need depending on where she lives and depending on her needs. She can reach out and say, I'm stressed because I don't know if I'm gonna have baby formula or diapers, or I don't know if I'm gonna need. She will find those free resources for her. After the
Okay.
baby's born, she will still follow up with her after the baby is 3 months old to make sure that, are you taking the baby to the first visit, the second visit, the third visit, And the program was only for at-risk moms, but now it's for any moms. Anybody can enter the program. So that's a good benefit that we have, and they feel support, especially maybe if it's a young mom or she had a hard time the first pregnancy. She's not alone. We're there all throughout her pregnancy. If there are no more questions for me, Marlon, I am going to go.
Paula, sorry to interrupt you, but can you share your email in the chat, please?
I'm sharing the Spanish flyer for the 18th event. I'm gonna do the English. I'm gonna send it. In the Spanish flyer, you have her phone number and her email also in the
Oh, okay.
white letters and so. Paula, since I'm gonna be emailing Donna, would it be okay to forward the email you send me with your flyers about all the topics and everything?
Everything, absolutely.
Donna, so that way you will get the same email, everything with all the flyers. Okay.
Thank
Yes.
you. Very good.
Rosemary, if you want also, if you want to share your email, then I can make sure that
Sure. I can share my email as well.
Okay, perfect. Wow, it's a very good a lot of information, but it's good information.
Paula, I have a question. By any chance, the last program that you were talking about, pregnant moms, do you have like a detailed information on that? Because I know before, like you said, it was only for high risk, but now you're saying that anyone qualifies. So do you have like more details on it? Like like a paper that, in that way, who can qualify?
I sure do.
Okay, so you can just email it, then that way if I have any clients, I know I can just refer them to you then.
Yes. If somebody, so this is really quick. It's called Healthy First Steps.
Okay.
That's what it's called. And we have prenatal nurses, and they help to provide clinical support, education. They assist all throughout the pregnancy. They help to find care, a provider, obstetrician, midwife, specialist, pediatrician. They just assist with everything. They set them up.
Wow,
Everything
that's
the
really
baby needs.
good.
They also have mental health needs, including depression, substance abuse, tobacco use, make sure they're okay. They have doula services under this program. So,
Oh,
doula, they assist during the pregnancy and the birth, childbirth. I love doula. Provide mom and baby with resources and referrals, breastfeeding education, lactation services, just so much that they can do. So anyone that has United, if the mom has United Healthcare, sometimes they have United Healthcare. They don't know that it can be part of this program. And now they're gonna have a nurse to be there for them and to help them.
okay.
And all they need to do is they need to call these numbers. If you want, I'll send you what I just read to you, and you
Okay.
will have it.
All right.
So let's say if you know somebody's doing, this is some of the things that when we have like baby showers for
Mhm.
moms, for an organization is doing a baby shower, we like to come in because it's the perfect audience to really tell them, you just found out that you're pregnant. If you have United Healthcare, you can be part of this program. And this all
Oh,
ties together with, maternal health and New Jersey, believe it or not, it's not the best when it comes to infant mortality. So, this really ties nicely. And we talk to them. And then we tie it with our health education when we meet with them. They, on a monthly basis, they can be part of like information about prenatal, postpartum depression, the importance of breastfeeding, the benefits of breastfeeding, mental health, just all over. So if you
nice.
have any families, anybody that you know, I'll share this with you.
All right, thank you. Thank you.
Perfect.
I feel like I gave so much information today.
You did. So, I mean, we're in the middle of 2 hours now.
So listen, you're gonna be there on Saturday, right? You too? Both of you are gonna be there on Saturday? Or no? Just
Yes.
Marla?
Well, I'm gonna be there. I don't know. I don't know if the other center is going to send anybody or not. We'll have to check on that. But I'll definitely
Okay.
be there.
Okay, I'm looking forward. And when are you doing like an in-person event presentation for the parents? Not yet?
Well, we have all our presentations in person at our site. Isis, I think you're still doing virtual, right?
Outside? No, it's too cold.
Oh,
It's too cold to be outside, but let's keep it virtual for now.
I'm waiting for the springtime and then we can have something, we'll have the
Okay.
tents and everything and yeah. But definitely, because we can just give out the information and interact with all the families, which I feel that they do need that.
Rosemary and Donna, Jennifer, thank you for being here and joining us. Also, Isis and Yolanda, and of course, Paula. If you guys don't have any questions at this time, we'll end our meeting. Rosemary and Donna, I'm gonna be sending you forwarding you the information from Paula along with the flyers for our event on the 18th. There's gonna be no registration, no appointment on the 18th. It's gonna be from 10 to 2 p.m. And depending on how many people come, we may need to do a second event. So we'll see how it goes. All right.
Thank you
Okay.
very much.
Thank you so
for
much.
Thank you
being
so
part
much.
of the
Thank you,
meeting.
Paula.
Thank you,
Okay.
Paula.
Anna,
Bye-bye.
Cualquier cosa me
Bye.
llamas,
Thank
okay?
you.
Okay.
Bye, everybody.
Nice to see you. Bye.
Bye.